maybe he bit into something or whatever, but the tooth just broke off and he was holding it.
Hey everybody, I'm Dr. Alan Williams with the Grapevine Dentist.
And I'm Dr. Daniel Choi with North Texas Dental Surgery.
And today, Dr. Choi, we're going to talk about how we as dentists decide or determine when a tooth, like a fractured tooth, can be restored with a new crown, or when we determine if a tooth needs to be extracted. So Dr. Choi, tell us about this case.
Okay, great. So this patient actually came in today and he had some dental work done in India and he was a little concerned. He was literally holding his tooth in his hands and it had basically, well, the crown with the little, what we call a post hanging out from it. And he was like asking, well, what was actually going on was that he has an engagement party going on this weekend actually.
Okay. And
he was obviously very, very worried because this is his front tooth and he's like, I can't do this weekend without that tooth. So he wanted to really know what his options were. So about 5 years ago, he said he had some dental work done in India. They did the crown on him. Okay. Well, unfortunately, this tooth, I'm not exactly sure what he was doing, but maybe he bit into something or whatever, but the tooth just broke off and he was holding it and he was asking me what I could do with that. So my question for you, Dr. Williams, is that something that we can basically recrown for him and make a new crown for him so he's good to go this weekend?
Yeah, good question. So whenever we have patients like this with a broken tooth, we take this kind of x-ray and we're looking right here, we're looking to see how much tooth structure is left for us to even put a new crown on. So I'll show you on our model here. Whenever we make a crown and we shave down the tooth here, we need some strong, healthy tooth structure to even put the crown on. Without that healthy tooth structure, the crown's not going to see and it's just ultimately going to fail.
Right.
So for this particular patient, I'm looking right at here, the level of the bone. All this, the rest of the root structure is embedded in bone, but only this small segment is above it. Therefore, this is not enough tooth structure for me to put on a crown. In theory, we could place a crown on this tooth, but it's just going to eventually fracture off if he bites into anything.
Right, because it's just going to fall off, right? So I like to tell people, it's all about the surface area, right? So if I'm grabbing onto you with my hands, am I better off grabbing you by the hands and pulling away, or just grabbing you by a finger?
Right.
Obviously the more surface area, it's going to be, a lot more strength in that bond.
Right.
So, but let me ask you then, so I have a personal opinion, but I have a feeling that because they put a post in here for that internal retention, that crown probably shouldn't have been made in the first place 5 years ago.
Probably not.
Right, exactly. So they should have probably done another option on him.
Right.
So Dr. Williams, what are other options if we say that this tooth is not viable because there's nothing to build on top of that? What other options are there?
So whenever we see this, we know that knowing the crown's not an option, this root needs to be taken out, needs to be extracted. So now we're talking about fixing the space. What are we going to do with our missing tooth? We have the option of going down the implant route, a more permanent solution, or a quicker option would be a 3-unit bridge crowning the adjacent teeth, both having their pros and cons.
Right, and they all look really natural, right? So they would look great. So let's talk about the pros and cons. Dental implant is, you don't mess with the adjacent teeth. You just place one single dental implant titanium screw. We have that model right here. You would never know that one of these is an implant until you see behind the scenes that there's a titanium screw there that's supporting this crown. The other option would be to, again, like you mentioned, shave each tooth down and put a 3-unit bridge there.
Right.
Again, when you're looking at somebody, you would never know that there's a bridge there. But Dr. Williams, what are some of the disadvantages of a bridge though?
Disadvantages of a bridge are taking off healthy tooth structure of those adjacent teeth. So those have strong enamel, very healthy looking teeth. And what I would have to do is shave down both of those teeth.
Right. So you would be damaging the integrity of the tooth and kind of exposing that tooth to potentially having issues later on down the road. Right.
These two adjacent teeth would bear the added stress that this tooth once bore.
Right. And also that margin isn't a 100% margin seal where that crown, that bridge meets that tooth. Then bacteria, tiny little bacteria, which is microscopic, can seep in there and start rotting the tooth out for years and we don't even know it. And then, one of my residency instructors always told me this, you don't want to turn a 1-tooth problem into a 3-tooth problem.
That's correct.
So
advantages?
Yeah, the bridge is very quick.
Time.
Yeah, time, just way, way, way quicker. And then also cost, right? So bridge is a little cheaper than doing a dental implant.
It is.
Dental implant, we mentioned, can be a great option. There is more expense to it. Not dramatic, but then there is more expense to it. The other thing is time. It typically takes longer to do a dental implant, especially in the front area. And I'll also tell you, having gone to residency and training years and placing dental implants and seeing thousands of implants, I've been in practice for 10 years, seeing a lot of patients that had dental implants also placed at other offices. If you're asking for something that can go wrong more easily, if you're not under having the procedure done with a skilled surgeon, you can have some aesthetic nightmares sometimes.
100%.
So you don't want to, you got to be very selective about who you go to get that implant placed. So it's just not one, it's you just have to be, discern more in regards to who you go to get your dental implants done. Now let's use another example also, where another patient lost their crown. So can you explain what happened with this case?
Yeah, so here's another patient where their crown simply fell off. Were they biting something? We're not really
Yeah, like back
likely.
tooth bit into something, the crown fell off.
And they still have it in their hand, right, Dr.
Yep.
Choi?
Yep.
Okay. So here's what I'm looking at. As the dentist, I take this x-ray, and again, I'm looking at the bone level right here. And so immediately I see that the original dentist that prepared this crown of this tooth, their margins are significantly high above the bone. What does that mean? That means that there's very little healthy tooth structure for that crown to even hold on to. So by submitting this crown back on here, it's going to happen again. He's going to bite into anything. That crown's just going to shear right off.
Right. Again, the whole surface area concept,
Exactly.
right?
It comes down to surface area.
In this model, like where you can actually see the margin of where they shave down that tooth, it's almost as if this whole margin is going to be all the way up here.
Right.
And we're just relying on that cement to just kind of grab enough of this tooth.
Right.
But I mean, come on, if you're chewing on almonds or eating whatever the heck
It's
you
just
are.
going to shear right off.
Yeah, exactly. It's going to fall right off.
But again, Dr. Choi, I'm looking at the bone level. Can I go back and lower these margins?
100%.
Let's do it.
So what I would have to do in a case like that is that in some cases, and I'm suspecting that's why this happened to this patient, if the gums are riding too high, some dentists are going to be a little bit too afraid to shave down too much of that tooth. So there's a procedure called crown lengthening where we can remove some tissue to basically create something called biologic width without going into too many details. But that's what you would need to do to be able to have enough surface area to put a crown on there properly.
But ultimately, we can save this tooth.
Yep, absolutely.
Okay.
We don't have to take the tooth out. We don't have to do a bridge. We don't have to do dental implants. That would be a better option. So one other thing though is that we can't just, even if there was enough surface area or whatever, we would have to refine this, what we call this preparation, right? To get rid of any bacteria that might have infiltrated the area, and also to, again, get enough surface area.
Right.
Yeah. All right.
Anything else, Dr. Choi?
No, that's it. So hopefully you guys found this information helpful.
And with any questions, give us a call.
Yep. Thank you.
Thank you.